My name is Susie Rabelais. I'm an RN. I work at Raymond Laborde Correction Center. I came in a year and a half ago as the infection control nurse and recently been promoted to ADON. I watch all the offenders, make sure their lab is correct and within normal limits for hepatitis. We screen for syphilis, give flu vaccines, chronic care. We respond to emergencies. We treat things like athlete's feet to a full code, to cancer, all sorts of things here.
My name is Wanda Dupree. I'm a registered nurse. I'm Assistant Director of Nursing over outpatient services and specialty clinic services and inpatient psychiatric unit at Elaine Hunt Correctional Center in St. Gabriel. I've been here for 8 years. The duties of my position is to assure that the proper care and medication is delivered to the patients that are in our care by the nursing staff in delivering what we consider is the gold standard of care in the Department of Corrections. In my position, I'm over the laboratory for all of the entire compound, as well as inpatient, outpatient clinic, which is like the doctor's office.
The types of nursing we do here is from acute to chronic. We treat a common cold, we draw blood, give vaccinations, teach our diabetics how to manage their blood sugar. Inmates will come in with seizures. A lot of times they're real and a lot of times they're not. That's why your clinical judgment, you learn what's real and what's not real. We do a variety of things and you learn all of that, from giving injections to port flushes to responding to emergencies. We also have clinic days, which is kind of like a doctor's office type setting. So it's very rewarding. It's just a great place to work.
For instance, I came here as a supervisor too, and in a short time was promoted to manager of the inpatient skilled nursing unit, and then was promoted to assistant director of nursing. There are many opportunities, and we start off with LPNs and RNs that are fresh out of school. This is a great learning experience because what we have here is a condensed community, whereas if you work for the ear, nose, and throat doctor, all you're going to see is ear, nose, and throat. If you work for an obstetrician, all you're going to see is pregnant people. But here, we see everything. When I moved from frontline bedside nursing to a more supervisory and administrative position, my focus changed from focusing so much on patients one-on-one to caring for my staff, being sure that they have what they need. That includes training, equipment, supplies, whatever it is they need to be able to do their job successfully.
I enjoy working for the state. They have great benefits, especially in nursing. I mean, you may want to do mental health. There's places you can do that. There's places you can go to specialize, like health units. You can come to corrections, which I encourage everybody to do because this is my favorite, where you can learn a variety of settings and do different types of nursing.
There are lots of benefits for all employees. Excellent insurance, life insurance, dental, vision, the ability to have an accumulated annual leave time. If you have overtime that is booked as compensatory time, you can use that in lieu of your annual time for vacation or personal days. And the other thing is there's a wonderful retirement system that's available, particularly for a younger person who's starting out. You can really make a career of this job. If you are looking for work that is steady and that is rewarding, that is financially beneficial, Department of Corrections is a good place to work. Some of my friends at local hospitals, they're getting flexed off because their census has dropped and they're not needed today, and so they're sent home and not paid. Our census is very steady. We need you every day to show up and do the job to the best of your ability.
Every day for every citizen.